Hello, everyone. I'm Natalie Kunzman, MD, and I felt as though we should have a discussion about COVID-19 from a physician who essentially has boots on the ground. So let's get to the very basics about what a virus it is. And it is one of the smallest microbes that is not a bacteria, and it is so small that you need special microscopes to be able to see it. So something you really need to know is a virus needs to get in our cells. So it needs a host for its survival so that it can reproduce and multiply. And when we talk about viruses being on a surface, we're really talking about those particles, and it's either made up of a DNA or an RNA composition. When it is on a surface, it is surrounded with a protein coat or something that we call a capsid. So it kind of reminds me of a seed or a seedling that won't grow on a box or a surface, but it needs the right environment. And that capsid can be taken into our oral mucosa or nasal cavity or ingested, and then it finds itself a cell or a host for it to do what it wants to do in our bodies. Now, the COVID-19 virus, or these viral particles, has been evaluated to last approximately 24 hours on a cardboard surface, and for some of the slipperier surfaces, it may last for 3 or even a few more days beyond that. So that's why we're exercising what I would describe in the healthcare field as universal precautions when you're managing these surfaces right now at a time where we are trying to contain this virus. So let's get into some of the numbers, and I won't quote the exact numbers, but the numbers in America are born from the limited testing supplies that we have. And when we have limited testing supplies, they are being allocated for the sickest of the sick or the healthcare workers. So what will happen is if you have a very limited supply of numbers of people getting tested, but you're only testing the sickest of the sick, and some of those patients may succumb or die as a consequence of this virus, it may make this virus really appear to be extremely virulent and a deadly killer. But if I can go back to Korea, early on, they had a whole readiness program in which, in the beginning, 140,000 patients, everybody got screened. And when they analyzed the numbers of those patients who perished or succumbed to the illness in relationship to the 140,000 people tested in the general populace, it was 0.1%. So I need you to keep that in mind, and obviously we're being cautious with this virus, but I don't want anybody in the audience to be panicking. What this has done, though, we call this a novel virus because it's new. We are now creating novel approaches to help take care of you all. So I don't want you panicking and feeling as though your other healthcare conditions or your upper respiratory symptoms or acute care issues aren't being addressed. We in the healthcare field, especially in the Colorado Springs area, have done some tremendous jobs of not only conserving the limited supplies we have with masks and personal protective equipment. What we have done was allocate those resources for a few in-house providers, while a lot of us can be home or virtual or in a virtual office to take care and address your needs by a telehealth or telemedicine platform. There are plenty of things that we can address for you and take care of. So again, do not be afraid or do not feel as though you are alone and without any health care, because we are here for you. We have gone into this game to take care of patients, and the novel virus has created novel approaches for us to do that. Now, all of that being said, you may need to take some matters into your own hands for prevention. What I like to tell people is this is the time to optimize your hand washing and your touch and your contact with people. Universal precautions, I think, just reared its head because of this, and I think we Americans have been kind of lax in our approach to some of these things. So wipe down your surfaces, keep yourself clean, be careful of mailed items that have come to your home. Be careful of your packages that you will bring home from the grocery store, and make sure that they are unpackaged, or they may even wait in your garage until we think those viral capsids have perished. But as far as the immune system is concerned, there is some great research with the Chinese where high doses of vitamin C has been extremely beneficial. Vitamin C, zinc, of course we all like our elderberry. The time now, since this virus loves to attack the chest and loves to create a lot of secretions, this is the time for you asthmatics to make sure your base regimen is under control. So take your medicines, take your inhalers, optimize your lungs. And for you smokers, now is the time to stop smoking. This is bringing a lot of our awareness to get back to the basics of life. And now that we are social distancing, I think we're all learning how to lead a quieter life, a simpler life, getting outdoors and walking and exercising. And this is, in many ways, bringing our community together and our humanity together to address a problem that needs all of our care and all of our intake. So again, you are not alone. Do not be afraid. This is the time to beef up the hygiene practices in your home and optimize your immunity, but this is no time for panic. We healthcare workers are here for you. Some of us are in the trenches in-house, and some of us are here for you virtually. Some of us are doing double duty. Do not be afraid to call your family practitioner, your normal office, if you have issues that need to be addressed, because a lot of us can do this for you without making you come into the office. And there are even some novel approaches if you need to come to the office. So many people, or many practices, are having the waiting room in the parking lot. So you can stay in your car and not be around the sick people until it is your turn to be seen. And that's just one of many strategies. So again, I'm Natalie Kunzman, MD. This was a COVID-19 alert, and as things become or change in the future, I can give some updates. Until we meet again, be well.